goal that the people who run these healthcare systems have is to maximize profit. And in their view, the human beings lose their humanity and they kind of become widgets for them. You're hurting people. The people are dying because these financial decisions you're making. You're going to have to go back and do it the right way.
Correct.
To let us take care of patients. Back then, I feel like the doctors had a much more important role in medicine than they do today. And whether people live or die is sort of a secondary concern.
Yeah, and you're running around and you don't have enough staff.
And that's resulted in policies that kill people. Welcome to the Dr. Nagy Show. I'm Dr. Aury Nagy, running for Congress in Nevada's 3rd Congressional District. With me today is Jessica Rolla. Rolla.
It's okay.
Who is a newscaster for Phil-Am TV here in Las Vegas, which is a fairly new TV station here in Las Vegas?
Well, technically it's been around a lot longer. If you know Asia Living Channel, the founder is also Carl Magno, who's been in Vegas and in the industry, I think, 40 years. And then my direct producer, you may have also been on the Pulse News. That's one of the programs on Phil-Am TV. The producer is Sam Buban. And
yes,
you've known Sam.
Yeah.
And he, I believe, and I could be corrected later, joined in 2023, from my understanding, as a partner to Carl. So we have now grown where I've been very grateful to be part of, a co-anchor for Pulse News and a newscaster per se, or lifestyle host too. I'm hoping to launch my new show in March, and that's going to encompass more about locals in Las Vegas. And I came from Chicago, so I actually don't know a lot about Nevada. Well, now I do. So I've been blessed because, my direct producer, Sam, believed in me, and I actually thought I was going to just work in marketing. And I actually have 3 hats, so it's really nice that I'm given a position in, it's actually a smaller station where I'm at, and then the Phil-Am TV is just part of many programs under the network.
Okay,
And,
so it's the Asia TV network is what it is?
Well, Asia Living Channel is what Carl Magno had created, and then with Dale Davidson, who actually runs the frequency, and that he was running Las Vegas Media. And the frequency, I believe, from what Mr. Buban said, my direct boss, is 26.8.
Okay.
So when people are on, the YouTube, Roku TV, a lot of the platforms, and now, as you know, digital streaming is where it's at. Now for 2026, Mr. Magno and Mr. Buban joined forces to be under a Global Filipino Network. And I was telling your crew here that it's under, we have Nudge Sports, Billionaro, and then if you can't afford to go to the Philippines or Asia like us, because it's like a 17-hour flight or we're so busy here, I mean, we could watch it on that channel. So there's so many little platforms that we have now. And then, as you know, we have YouTube and Vimeo. And I mean, we have so much, but we do our best to try to reach, again, a wide audience. But with the Filipino Americans, I mean, you've been very supportive. We are all inclusive with all cultures. And as you know, with Vegas, it is a melting pot too. And I didn't realize we're like the 3rd largest ethnic group, but it's very mixed now with 250, I'd say almost higher than that, 250,000 Filipino Americans, again, with mixed race, like spouses and kids, and a lot of seniors, I think you know, too.
No, it's been really, really interesting seeing the Filipino community grow here in Las Vegas.
Yeah.
And kind of grow in importance in the nation.
Yeah.
Right? You know, the best fighter in the
Manny Pacquiao.
Manny Pacquiao, right? So he was
he is what we got here, especially in Vegas. Yeah.
Yeah, he got, but also Miss Universe was a Filipino lady too.
Yes, Pia.
Right?
Mm-hmm.
And,
a couple of them.
And so many fantastic singers are Filipinos. I think the lead singer for Journey was amazing.
Yes.
That guy's voice is just phenomenal.
Mm-hmm. So many.
And what's that?
So many singers and entertainment. That's what we're, I think, known for, I believe. And then, we have the one athlete.
Well, it's not just that. There's
a couple more, I think. Yeah.
I believe there's a U.S. 5-star general who's a Filipino. I believe that's true. I believe that's true.
Maybe.
And Joe Coy. Yeah,
he's big.
One of the best comedians in the country right now. He's fantastic. And there are a couple other things that were just. When I started reeling them off and thinking about it, I was like, wow, it's just like it's the degree to which they've risen in prominence in our country is, and the degree that they're contributing, and all in positive ways.
Yes.
From what I see, I don't see from that community much in the way of like terrible crime or fraud or.
I hope not.
Right? But I mean, it seems like they're doing something over there, turning out a lot of people who believe in very wholesome kind of family values type type of culture, which is really, really nice. It's really, really needed in today's country.
I agree. I think I was always raised with, and I'm proud to be Filipino American, but even coming as a legal immigrant, you know, my late mom was, as I mentioned before off camera, and I'll say it here, that she was a VA nurse. And there was a whole migration of the Philippine nurses, and they did what they could with being students. And when you're asked to come back to the US government to live here and then petition, and luckily my father got in here and he was a businessman, and my brother and I, it was way back when, and we were, you know, luckily able to do it. So many families are not as lucky. And, you know, we did escape martial law under Ferdinand Marcos at the time. So that was way back, and I'm very grateful that our family stayed together. You know, nobody was separated, or there was no issue or chaos how we got here, because my mom was already a student nurse when she was 19 years old, went back to the Philippines, and they did the proper paperwork and got in. And it was just different back then, too, from what I know.
Which part was different?
I think just the whole process, you know, and I think maybe because she was lucky and she, like yourself, in the medical field, I think you have a different way to, you know, fill out all your paperwork. And we didn't have the internet, so we probably had to wait for the mail, you know, like a lot of people. And then there was no, and I hate to say it, but I'm all about social media, but it's affected, I think, our nation, right? And so many of us get affected by opinions. And I think we just did it the one way or the highway and waited for that letter to come in, or a phone call. Well, there was a phone back then. It was in the 70s, so we had a phone.
You know, that's an interesting point.
Right? I'm just bringing that up now. Isn't that interesting? The communication was simple.
It was, and maybe that's what helped people to stay focused on family, right?
Correct.
Because that's who you spent most of your
Correct.
time around. Those are the people whose opinions influence you the most.
Yeah.
And now, when you're connected to social media, the influences that you have on developing your personality are from outside of the family. And
I agree.
For kids who spend more time with social media than they do with their family, that can be destructive.
Yeah. And not to say that I'm not modern or believe in AI or technology, but I think that when you have a family that, you know, guides you with books and higher education, and I'm not saying everyone has to go to college or medical school necessarily, but for me, I graduated with a business degree or a double minor in fashion design and fashion merchandising, which that wasn't even a thing.
It's okay, I got it. Nice.
My parents were like, you know what, she's creative. She likes to read a lot. My father honestly wanted me to be an attorney. And here I am with Phil MTV hanging out with attorneys and politicians. So he's like, yeah. So he watches me on Roku or YouTube, you know, and it's I feel like healed from that, because I feel like finally I'm actually, you know, I'm getting some, you know, traction, and I feel like he was right. I think getting into media was a good thing for me, and I'm lucky because it's all about, you know, just communicating correctly and having the family values. And I had a solid private school education too, and you know, I was very lucky because my parents really made sure I finished school, and I didn't rebel too much.
But you know, you were talking about the nurses who came over from the Philippines, and that is a huge part of the medical industry here in Nevada. All of the hospitals have nurses who came over from the Philippines and contributed tremendously to our community. We couldn't run the hospitals we have here in Nevada without nurses from the Philippines taking care of everybody, and doctors too. They have a bunch of great doctors came from over there too, right? So yeah.
Neurosurgery. So when you went to school, I mean, was it a similar way? Like you stayed here because I had read about you, and you know, I did my homework because you know, I know you're asking me questions. But how was it when you went to medical school, or was it the same? It was all here, right, in Nevada?
Oh yeah,
yeah, everything. No, you went out.
So I was born in New York. I got to Vegas when I was 3.
Gotcha. Similar.
And I went through high school, so I went to Gorman for high school, and I went to Yale for undergrad, and then I did med school at Baylor, and then I did my neurosurgery in DC. And
traveled.
Yeah. And
good.
so
Awesome.
so when I finished my neurosurgery and training in 2004, I came back here to practice. So I've been practicing for about 20 years.
That's great.
Well, 22 now.
Yeah.
Yeah.
Oh wow, what a long.
It's been a long time. But so I've gotten to see medicine evolve dramatically over here, and you know, because my parents were doctors too, I sort of saw what medicine was like, you know, in the 70s and 80s, to where we are now. And it's very, very different.
It's very different.
Back then, I feel like the doctors had a much more important role in medicine than they do today.
Yeah.
I think when the doctors said, the things that you're doing when they talked to the hospital administrators, they had the ability to say, look, what you're doing is wrong. You're hurting people. The people are dying because of these financial decisions you're making. You're going to have to go back and do it the right way.
Correct.
To let us take care of patients. And at that time, the hospitals were willing to let the doctors make those decisions. Today, they're not. Today, the hospitals make decisions on a financial basis, and whether people live or die is sort of a secondary concern. And that is very upsetting to see. And there's been a gradual change in the way that hospitals interact with physicians, and they have over time taken more and more and more control over the medical executive committees that doctors sit on. They're supposed to govern quality, and now they have just become sort of rubber stamp organizations to put the doctor's seal of approval on whatever the executives at the hospital want to approve. So, and any doctor who opposes that gets thrown off staff, and then they can't feed their family, and so they end up having to just say whatever the hospitals want them to. And that's resulted in policies that kill people.
Yeah.
And that's really horrible.
Yeah.
And the doctors and the nurses both feel that. I tell people that it's a lot like standing at the edge of a swimming pool.
Yeah.
And you see somebody drowning in front of you. And as a doctor nurse, you know what to do to save them. And you just reach your hand out to try to help them. And then the hospital, the insurance company grabs your arm by the wrist and holds it behind your back. And they have to stand there and watch that person drown. And you have to do that, that day and the next day and every day that week and every week that month and every month that year. And it breaks people. There's a lot of suicide, a lot of people who leave town because they, can't take work in that environment here. And people who try to do anything about it, nurses, they get fired, doctors, they get kicked off staff.
I didn't even know.
Or thrown off insurance panels. It's really bad. When I started trying to do things about this, and I was calling for the medical board when I was president over there, I was calling the people on the DO board, the nursing board, the dental board, and the psychiatry board. When I called the nursing board, I had a nurse, break down in tears. She was so happy somebody's finally doing something to start to right the situation, because it's incredibly frustrating. I went up to there was a state senate bill, I think it was 182, and it was about what the nurse-to-patient ratio should be for the hospitals.
Okay.
And they, had 150 nurses down here, another 50 nurses up in Carson City who were all testifying, trying to get the legislator to listen to the fact that there are people dying regularly because of the policies the hospitals institute to understaff the floors.
I see.
And, just nurse after nurse got up there, cried, talked about this patient I had died, this baby I was taking care of died. It was just, and, for whatever reason, they were unsuccessful in getting their bill pushed through, and that was very troubling. That was a hard day to sort of see the way that went. So, the lobbyists who work for these gigantic corporations are very effective, and they are able to work with the legislators. And I think the version of the story that they give them is somehow very, very convincing. And so at first, when I was, going to run for office, I was going to run just at the state level so I could start to spin the truth up there.
Right.
And tell those people what's going on. And then I realized at some point that some people I was talking to here about getting that campaign organized, I said, Aury, anything you do over here is just going to get overturned in Washington. And so you can put forward a plan here and fix things, and they'll just pass laws over there to undo everything you did.
Oh, wow.
So, right? And so then I was like, all right.
Got to change that.
Well, then I'm going to go to Washington, and I'll tie them up over there so that they can't affect what we're doing over here. So kind of keep them out of our government down here.
Now you're running.
Well, just so. So we got a mission in mind. We think we can fix healthcare in Nevada and the whole country, save hundreds of millions of dollars, save a lot of lives, put healthcare workers back in charge of making decisions for their patients, and just really, I think if we're able to fix healthcare, it will save hundreds of millions of dollars for our state, trillions of dollars for the government, and that will make everybody in the country feel wealthier because they're paying less in their insurance, and if they're feeling wealthier, they'll spend more, they'll have more to save in their banks.
Yeah.
And when you can save more in the bank has more cash. That means interest rates will fall so they can make more loans. And lower interest rates means businesses will thrive and property developments will happen and be great for construction. So we think we can really, it'll be like pouring, if we fix this healthcare thing, we think it's going to be like pouring, jet fuel into the economy.
Yeah.
is really going to take off, and we'll be able to compete effectively with China, India, the other rising economies of the world.
I think they're understaffed with a lot of, like, just even the medical receptionists.
Yeah.
I feel like, and I'm not saying that they're not doing a good job, but I feel like, right, there's just not enough of them. Where maybe like in a very busy, I'm not going to say where, Summerlin, and we live around here, I mean, it's just hard to even get an appointment sometimes. It's not a phone call, it's obviously an email or an app. I just feel like there's not enough of that.
So what happened was,
Yeah.
with the rise of corporate medicine and these corporate insurance companies,
Yeah.
they are actively and aggressively compressing the reimbursements for the physicians, and so that means there's less that they can spend on their healthcare
Like
workers.
private practice.
And so their response to it is to just hire less people or less qualified people because they can't afford, more qualified people.
I could see that.
And so then the person who you would get on the other end of the phone, if you can get them on the phone, because there's less of them,
Or website.
is going to be, less,
Less.
less capable than
Yes.
the people you could hire, 40 years ago.
Yeah, like 40 years ago, or even 20 years ago, it's like, you had that same family doctor, or, it's kind of not existent anymore. Do you notice that? Because I find like if it's a primary, they're working at, say, UNLV, then my husband's doctor is going to UMC. Like that's typical to be at 2 or 3 places.
Yeah.
Yeah, and you're running around and, you don't have enough staff. Or hospital manager, that was more of a Midwest position. I don't see that here.
The goal that the people who run these healthcare systems have is to maximize profit. And in their view, the human beings lose their humanity and they kind of become widgets for them.
Oh, that's a good point.
And so they, life and death become something that they're indifferent to because they don't have to actually visualize it. It's just a mark, it's just a column
They're not there.
on their spreadsheet.
Yeah.
And that causes a lot of pain, death, and suffering in our community.
Yeah.
And so it takes people who are there to bear witness to it.
Yeah.
To get motivated to actually start to make that change. And these corporate entities will not change unless it's financially painful for them. If you can rework the incentives and either threaten them with legal action through lawsuits, or change the laws within which they operate to restructure their incentives, and that's what we're trying to do.
Okay.
I think we can restructure incentives so that healthcare is more affordable and more humane and provides better care.
Okay.
So that's the goal. But so you were telling me some history about the Philippines earlier.
Yes, I was.
I got really interested in Filipino history when I read a book called The Cryptonomicon.
Really?
And
I gotta see that one.
it's a really, really good book. And it talks about how, I'm going to give away some of the books, so if you want to read it, don't listen to this part. But it talks about how during World War II,
Right.
the Germans were trying to get a lot of their gold that they had taken from Europe out of the country and hidden somewhere. And so they were working with the Japanese, and they were going to ship it over to Japan, but to the storehouse they decided on was they were going to store it in the Philippines.
Oh.
And so the idea is that there was this cache of German gold, stolen German gold,
Interesting.
cached somewhere in the Philippines, and that was going to be used as the value reserve on which Bitcoin was going to be based.
Really? Wow, that's an amazing story. And
Oh, it is, yeah.
here we are.
And so in this storyline, it's a really good book because they talk about there's World War II history, and there's current history, and there's cryptography, and the
big
Bitcoin.
now.
But what I learned about were in the Philippines, I learned about the Huks. And so the Huks, H-U-K, were the guerrilla warriors who were up
I
there,
know about that, yes.
fighting against the Japanese.
Yep.
And so I learned about those. They were very, very tough guerrilla warriors. And then I learned about the Eskrima, which is apparently the most deadly version of martial arts in the world.
Oh,
because which is developed in the Philippines.
Yeah.
And this is the experience.
So interesting, right? Yeah.
The experience that I've had with Filipino people and their history and their culture is very, very different.
Friendly.
Than what I've read about.
Right. Oh, no, you're right.
From, I think, MacArthur. When MacArthur
That
was
changed
over there,
a lot.
he had written somewhere that the Filipino people are like children.
Yeah.
And I guess he was talking about their level of innocence.
Correct. Yeah.
But so I thought, you don't expect sophistication, but then I learned all this other stuff. I'm like, wait a second.
Yeah.
I think he had a very superficial
He had it
level
more
of
of a, I
interaction
think
or
so.
understanding, right? Or maybe a colonial type
I
mentality.
think it was more colonialism that
Yeah.
affected our history. And even if, say, and I shared this, my great grandfather was a general, and it's not something I even like knew till I was older. And we have, my maiden name is Jakosalam, Hakosalam, and it's in Cebu City. So when you talk about the warrior mentality, oh, it was there. And a lot of nationalistic, feelings. I mean, I'm not going to lie. I'm sure not me, but my great grandfather, they wanted to keep Cebu, you know, intact. So, then, right, when colonialism happened, I'm sure that affected that whole warrior mentality. But being educated with as time went on, yeah, we were very much influenced by American society because of the U.S. military. And World War II affected that. And yeah, McCarthy. So, of course, I think he saw the benevolent side and peaceful side of the people. And, of course, the childlike image. And we were more, I'd say, assimilated, because that's just how I was raised too. And I never debated that because I'm, very pro-American because we're immigrants. But when I'd see my great-grandfather's side, and I'm sure they were totally different because we are warriors.
I mean,
it depends which island.
I mean,
Not my mother's side, my father's side, yes.
what I saw was a
Whole different image, yeah.
a lot of Filipino guys kind of went through the military, and we'd
Of
see them in the
course.
hospital. Sometimes, that after military, they'd come in and they'd be
yeah.
like scrub techs, or we'd see them in the OR. And a lot of the ladies went in and became nurses, and so we'd see them in
Yes,
the hospitals in
yes.
this way. And
Yes, it changed.
but a lot in the military, right? And
Oh,
and
yeah.
that's why I was like, I wasn't so surprised when I said there's some 5-star general who's a Filipino guy.
Oh,
So
yeah.
kind of just the degree of competence, right?
Yes.
Is a big deal.
Yes.
And it's contributing a lot to our country in very positive ways. So kind of very happy that they're part of our, they're working on our side as opposed to say for China or something, right?
Have you done a lot with the VA here? Because I know there's one, like the Mayor Shelley had said in her speech when we saw each other again at the Vets Gala a couple weeks ago. I know there's one, but I don't know if there was more than one location because people didn't have access to that.
The VA's facility is pretty far north.
Yeah, I've seen it one time, yeah.
And so I don't go down to that hospital. They have mostly VA doctors.
Right,
They
I
don't have
figured.
neurosurgery over there.
Yeah, right. 'Cause you're in
So
Nevada.
there's not much of a role for me over there.
Yeah.
But I do see a lot of veteran patients.
Yeah.
And they had VAs in both medical school and in Virginia where I trained, in Virginia, D.C.
Yeah,
where I
no,
trained.
definitely Virginia.
And so, as a matter of fact, we when I was a chief resident, I had some of the guys from Walter Reed who were going through the neurosurgery program over there. And so, neurosurgery is it's pretty much the most difficult thing you can do in medicine. And so the kinds of people it attracts are people who are looking for a challenge. And so the military guys who went on to become neurosurgeons, they were almost all ex-special forces guys.
Oh, wow.
They had joined the military, said, what's the
tough.
toughest thing I can do here? And then when they got to medicine, they said, what's the toughest thing I can
You're
do
mentally prepared too.
So I was a chief resident, and I had to, get the respect of all these, guys junior to me who could, kill me with a paperclip, right?
I hope not.
And who were very capable.
Well,
of
right, they
in
were
very
just used to
difficult
all those
situations,
situations.
right,
Correct, yeah.
And so
They're hardened from that.
and so that took some work, right? I mean, I was able to succeed with it, but I got a lot of respect for what they did. I remember there was a day when the Kosovo War was going on.
I remember that.
With the Bosnians, and a clip came on TV, and we had all been talking about medical stuff, and the clip came on, and everybody got quiet, and their eyes riveted to the TV, and they're all staring at the situation, and then as soon as the clip was over, they started chattering and using all these acronyms and words I had never heard before and didn't understand, and there was like a whole terminology and vernacular about the techniques needed to take this, cliff top, and they were all arguing about, well, they were using the wrong ordnance, and they should have come from this way, and it was at that point that I realized all these guys we have working in the military, they have a kind of a brilliance and rigor and knowledge base that is on par with any other professional in any other field, and it was very, very impressive. And I pity our enemies in the world.
Right.
Because the degree of competence of the American military is phenomenal.
Yeah, I can agree with that, and I don't have a problem being proud to say that, because with everything going on in, I don't know if you want to talk about immigration, but with ICE, I see both sides of it, but I'm going to stand by the U.S. military and how we try to handle it, especially here. It's not so combative, but yeah, if it gets to that point, I have every faith in the military here, with the Air Force too.
Yeah, no, we have a strong military presence here in Las Vegas,
Especially
and
Nevada.
a lot of vets, and I think there's a lot of respect for our military forces here in Nevada, which is a good thing. I think the whole ICE situation is a tough one.
Yeah.
I think they armed them early
Correct.
when they mounted up,
The
because
Katrina.
the fear was that there were many members of these violent drug gangs that have been pushing fentanyl into our country.
I agree.
And the fear was that they were going to come into conflict with them immediately, and that they needed to be armed. And I think that need to arm these people who are just new to this force is put them in situations that they might not have been prepared for had they had 3 or 4 months of training, how to use weapons, how to use lethal force
Could be.
in civil situations. I think now it might be useful to go back and have them undergo that training, and maybe restrict the use of lethal force until they've completed that training.
I agree with you on
There's tasers,
that.
pepper spray, and all kinds of things they can do to sort of prevent the death of any American citizens at the hands of our own government. That's something we should definitely do everything we can to avoid.
I agree. I think being conservative too, it doesn't mean that we're not pacifists. You know what I mean? I think there's an image that, if you're leaning that direction, it's not about lethal force for us, or supporting someone that, say, you're like someone I know is married to someone in law enforcement. I mean, it's not about them being against you. They're trying to protect you, and public safety too. I'm sure you agree.
Yeah.
Yeah, we have a strong, I like it living here in Nevada because of that. We do have, I think, good law enforcement too.
No, I remember there was a gentleman whose a wife was a nurse, so
Yeah.
I'd gotten to know her, and her husband died. He had been an undercover cop here,
Okay. Oh, wow.
and so I went to the funeral, and there must have been 200-300 police cars at the
Oh, yeah.
for the procession. He's a very well respected person, and so I started to hear about the difficult situations that police officers, life and death
Yeah.
situations that they find themselves in, where they risk their lives for our benefit, and it's very real. And we are right to have gratitude for the work that they do to keep us all safe.
Yep.
There's a lot that happens in this city that we gratefully never have to hear about, because they're taking care of it. So what is with Phil-Am TV?
Yes.
And a TV station that you're working with, and that exposed you primarily to the Filipino community, or the broader Las Vegas community, or?
Well, doctor, I'm doing it all.
So tell me.
So coming from two aspects, I'll start with local, because this is my dream, was just to be local in Las Vegas, and I'm finding such a great, almost another higher education with learning about actually the history of the Philippines again, like you mentioned, but what's going on right now. And so the show, and you've been with Sam and Joe when there was maybe just the election, right? Was it just covering the election? And then when you leave, or say we had Ray Kennedy, who I'm happy to say she's on the next Pulse News for next week on Monday or Sunday, Monday, tomorrow it's airing for the week. We also do a 30 minutes of an international. So that's why I'm learning all this new history. And, we research that. And then our broadcast is also from Manila. We have a editor that actually trained me when I started, and then we researched it with our editor in the Philippines. So we cover everyone. Also, and I learned about Syria, what's happening with them, and parts of Dubai and other Asian countries. So Phil-Am TV is not just Filipino Americans in Nevada. We cover that with the political race going on, and local news, and then we do a half hour or so. I'd say 15 minutes. We film for half an hour. We edit it for 15 minutes for the international news. So it reaches globally. We're global now. Global Filipino Network is with Phil-Am TV.
We're really excited, because we've been talking for a while in my campaign about
Yeah.
how Nevada's media is sort of biased pretty far to the left.
It has been, yeah, unfortunately.
And how it's difficult for there to be even objective voices, let alone voices on the right
Unbiased.
there.
I'm trying.
Well, and it's so nice to have groups like yours that are
Yeah.
coming out there with
I'm not
that are
afraid.
providing a platform
Yeah.
where people can just hear the unvarnished truth,
Yeah,
which our community desperately needs.
Yeah, and I'm not going to lie. I had been raised Democrat, and I was actually Democrat with my family for many years.
Yeah, same.
With President Carter. And remember the bicentennial? I guess we could do the math. How old are you?
Oh, yeah, you're right. Yeah.
Oh my gosh.
Oh my God,
I was
yeah.
in school. Amy Carter, it was like kind of close to her.
76, yeah.
I love her. She's still around. And,
Is she? I
yeah.
haven't thought about her.
She's, I think, in middle age. And then, anyway, then there was a president. There was a lot of presidents that were Democrat. And then I went into Reagan. Then I got into acting and modeling. And my whole career was I was always around like liberals. I went to a liberal arts college. And I'm not going to lie, I went through that and I questioned everything. And then had so many friends I'm still very good friends with. And living in Chicago, the city itself is very blue. And I have no problem with it, but then I have friends like, I don't know if you know Rudy Pimentuin, and I don't think he'll mind me mentioning, he lives here now.
I mean,
a lot
I
of
didn't know his
transplants.
last name. I met Rudy, yeah.
But we have a lot of, like, I was more in the closet being Republican because it got to be a little bit toxic.
You know that's
I'm
true.
just saying.
I talked to a lot of,
I'm not gonna lie.
Republicans who were like afraid that God was right, actually.
Right.
Yeah.
And it was just not that I was afraid something was going to happen to me. It was just the feeling I got, and it was pre and post COVID. And the George Floyd thing was very unfortunate.
Yeah.
But I think, like I was talking about, I think there's an image that all like independents or Republicans are very, we don't want to enforce anything on, the gun control. I think that was it, the gun control. And I don't have one, but I'm considering doing conceal and carry now living here.
Yeah.
But I don't think there's anything wrong with that. But I'm still pro-life, so I'm not being hypocritical, but I feel like it doesn't mean I'm not compassionate. And I think that's the whole image. I like living in Nevada because I was talking to your group here that I'm a peaceful Republican type person, now that I'm an adult.
I think you hit the nail on the head. There is a perception.
I think it's a perception,
that by people on the far left that Republicans aren't compassionate people.
Yeah, that's not true.
But I think almost most of the things that they do are driven by compassion and desire, to have a better community for their children and families, that they, are safe and that they're, secure and that they have a bright future that they can look forward to.
Yeah, and I was even with a county commissioner, and she's nonpartisan, Minja Yan, and then there's Lena, and there's a couple others, and Minja was saying that, like, and they're so careful what they say around me, and they say, well, she's a Republican, he's a Republican. I'm like, I don't hang around just Republicans, I hang out with everyone, where on camera, I'll be professional, but the judges, too, help me out with how to promote, how I feel. And they're like, you just have to be you.
That's good.
But nonpartisan helps because I see it both ways. But I definitely, I think the perception has to change.
I agree. Yeah, and I think it'll be good, where people can see that it's okay for people to talk about ideas.
Right.
And,
right.
It's an unbiased place where, like you guys,
we do our best, yeah.
We're going to be hosting an event here in Las Vegas. So, after Charlie Kirk was shot.
Yeah. Oh, it was...
right. It was sort of the death of free speech on campuses. A terrible tragedy. This young man.
Can you imagine?
And that somebody was so driven by whatever drove him to commit that action.
Yeah.
It was just the rhetoric had swirled so high.
Misunderstood, and I think social media again had something to do with that.
I agree. Well, what we decided as a reaction to that, with this sort of death of free speech on campus, we would host an event here in Las Vegas to demonstrate that college is supposed to be the place where people can come together and civilly discuss ideas politely and respectfully, and that we can all listen to each other without having to go off into our own corner. So we found the oldest and largest political debate society in the country, the Yale Political Union. And we invited them to come here to Las Vegas. Okay. And so these college kids are going to pick whatever the two most controversial issues are in the country. Okay. And debate them. And we're going to have people, everybody in the audience is going to sit and listen, right? And however they feel, they're going to respect these kids have a right to sort of sit and just talk freely about what seems to be, and they're, they're kids from Yale, they're going to bring the evidence and the receipts with the things they do, but it should be really interesting. So it should be happening in about 2-3 weeks.
Okay, so you're going to make a big announcement.
I'm invited, yay! If you want to come. So
I would love to. I'll ask I have a young, new, bright camera videographer, and I think he would be a good representative because you need to reach these Gen Z, is it? And I don't have biological children, but he's like the son I always wanted. I have several nephews and nieces, but yeah, as a media professional, yeah, I like to learn, and I need to get educated because we need to know what they're thinking. The younger generation, they're gonna take over one day, right?
And we thought we'd try to set an example for college campuses
That
around
too.
the
That
country.
too.
That like
Make
it's
it
okay
peaceful.
to have political discussions and to let people talk to each other, and that we should be respectful and do this. And I will tell you, it's going to be over at the UNLV Law School.
Yeah,
And they were
UNLV is
concerned.
very, yeah.
They're very
take care of
concerned
it.
about security, right? They're like, well, they don't want something like what happened
Right,
with
what
Charlie Kirk
happened
to happen.
before.
And the fact that they even have to worry about that's the tone and level in our country, that's extremely destructive to free discourse and freedom of speech, and we really need to make sure that's discouraged. That kind of level of rancor and opposition is discouraged and suppressed really everywhere.
Yeah, I think with what happened a couple years ago, there was a shooting. I think that had to do with a professor not getting a job. I think that was why they had that shooting. I think at UNLV. But
Oh, that's right. Yes.
Yeah, that just came up because one of my friends, her daughter was in that, so she had we could talk about that. But with mental health, it's like you need to make sure these kids are not traumatized. But I think security, like I said, I've been here for 2 years living here. Maybe that's not long enough for people to know, but I believe that we can just try to, repair that, situation. And again, a new event would be good, with obviously good security or better security. I don't even think it was a bad thing that it wasn't the security that happened. I think you just have to have trust again.
No, they did bring private security.
Oh, good. Okay, good.
Yeah,
Okay,
so, yeah.
let's just double check. But can you really control everything? You can't. Life is about that. You really have to just have trust again and see where it's going to take us. Maybe the people that are very afraid can always do virtual, but I think that you're doing a great thing by implementing this, because I think we need to do our best and bring it to Nevada.
So what should people? What message do you want to let people know? And what can I do in Washington that helps the community that you represent?
I think with Washington, I think if there's more of a narrative where we want to implement the changes, especially with the healthcare, because coming from, again, I grew up in the Midwest in Chicago, Illinois, that was completely different than here, where it shouldn't be this huge shock of getting more staff here. I mean, there are jobs. We are creating jobs, right? If they want them,
Yeah.
And I feel like if kids know in school, that this is being offered. There's a lot of great trade schools too. I think the narrative about we don't have good education, that's not true. I think there's a lot of good schools in Clark County.
It's really been improving. I know the governor's very proud of the work that's been done. Nevada's been sort of clawing its way back up via the ladder of the rankings of the schools, and he's attributing a lot of that to the work that he's done to increase accountability for teachers and the increase in the charter schools in our state. And I don't know if you've been to any of the charter schools, if you've gone to did you go to the event they had where they had all of the schools, all of the private schools show up in the charter schools, where they're sort of convincing parents to come in? I was floored. They must over 50 schools represented there. Mm-hmm. And I was floored by the fact that all of these people who've sort of put their shingle out to say, I'm going to run a new school, they believe that they have the solution to education, that they're going to be able to do it better than everybody else. Mm. And you know what? One or two of them are going to have
one or two of them will do
something better.
Yeah.
And the next year, all of them will have adopted that way of doing it because they see these people are successful and it's working.
Yeah.
And education will therefore iteratively improve because of the competition.
Yeah.
I'm so looking forward to that happening. It's really, really great that's happening in our community.
I mean, I say this a lot and I hear this a lot. I mean, Nevada is small but big. And I feel like if you have those community groups, it's important. Junior League's the same way. I meet a lot of parents. Mm-hmm. And Junior League too is a volunteer group I'm in. And there's a lot of that they are always asking us to do shifts. It's a volunteer shift for going to the schools. So I've been to several. Not just Summerlin. I've been to Centennial Hills, Spring Valley, underprivileged areas, and there's charter schools too. And they have so much room for, we do a lot of fundraising, and I believe we can get in that better direction. It's just, I think, what people think that we are. I think the image is changing, like you said, and that's what we need Washington to hear, that we have the manpower. We have so many people that even want to volunteer, like myself. I'm not just about work. I try not to be. See, I'm here. I'm actually having fun today.
Good.
So I don't feel like it's work all the time when you're helping the community. And Washington needs to hear that there are people that want to make it better here.
What is Junior League about?
Well, Junior League is a group that has been along, I think, 100 years. Here it's 80 years. So Christina Velarde is the president, and I like to talk about her too because she's the current president, and Tia Mathis was a president, Tia Mathis Coleman, and she is running for treasurer for this election.
Nice.
And then Brittany Miller, you might know, she's running for Nevada Assembly. There's so many great women. It's a women's volunteer, but they have men, obviously, and my husband's gone to the Help Nevada, and we've done a lot of fundraising for helping those that are homeless, those that don't have any families. So Junior League is a great way for me. I also just joined because I just needed more friends here besides you. And I didn't get my job through there. I just was more about helping the community. And I feel like, and then there are women that do it because they're in between jobs, or maybe they don't work at all and they have kids and they just want something to do. But that has changed over the years. It's a lot of really high, quality women that are educated, or just maybe they transferred from a different city like me. They have one in every city.
Okay.
Yeah. So
there's another really good women's networking group here. I think it's Sharon Young runs it. Women professionals in business.
I'm sure I've heard of it.
They host their meetings just down the street at the Brazilian Steakhouse.
Oh yeah, that's a great place to go. They seem to really have a lot of groups there, and alignable mixers, business mixers. So yeah, I guess I'm that personality that, because before I got into Film MTV, I was just in the right place at the right time, and then when I went to Film MTV, I wasn't really expecting all this. And it was a nice blessing because it is something, I guess, from what people say, I'm good at being social, but it's a community thing. I knew I was going to get in some kind of public service position at some point in my life. And now I'd like to, keep helping you, and hopefully it'll work out. I know you have my vote.
We're so glad to have you here in our community, and we're grateful that you came.
Yeah.
Thanks so much.
So yeah, we're hopefully it'll be best for you, and see what happens in November, or it would be June?
June.
June.
Will be the primary, and then November after that if we get past June. I'm Dr. Aury Nagy, running for Congress in Nevada's 3rd Congressional District. Today we have with us Jessica Rolla, who is a newscaster and a TV personality on Film MTV.
Yeah.
Please tune in and watch her, because she's got great things to say, and they're providing objective news coverage of our valley there.
Thank you so much, Doctor, and have a great rest of your campaign.
Thank you very much.
Okay.
Thank you very much. Go out and vote, guys.
This podcast is a campaign communication paid for by Nagy for Congress and authorized by me, Dr. Nagy. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the campaign or its affiliates. Discussions are intended for informational and conversational purposes only and do not constitute legal, financial, or professional advice. Any references to public policy matters reflect general positions and priorities at the time of the recording and are subject to change based on legislative process and voter input.